other weapons. Will the new healthcare law make it harder for you to get a doctor's appointment? Well, according to the Association of American Medical Doctors, the nation could face a shortage of as many as 150,000 doctors in the next 15 years. So there is a possible solution: nurse practitioners. But as News 4's Craig Cheatham discovered, a fight over money is keeping them from filling the void that will probably affect a lot of local families.
Okay, we'll do it real quick, and that's it.
With charm and a soft touch,
It looks like he has a little fever.
nurse practitioner Jane Hicks puts the most uncomfortable children at ease.
So she's pretty congested, but her ears look good.
Hicks, a longtime registered nurse, got more education and training so she can prescribe many medications without consulting a doctor.
We can handle about 90% of everything that comes into the office. Most of the things I deal with all the time are colds, ear infections, sore throats, relatively minor illnesses.
Let's listen to you breathing.
Nurse practitioners say the advantages of their care are obvious. They cost less than doctors. Patients can often see them right away, while a doctor may not be able to see them for weeks. NPs can diagnose patients and prescribe many medications. But Missouri is one of the last states to let them prescribe controlled substances like cough syrup with codeine.
We were the 48th out of 50 states to actually get controlled substance privilege.
But Garzon, a nurse practitioner, PhD, and professor of nursing at the University of Missouri St. Louis, says the law still hasn't been put into practice.
By placing this barrier to me practicing, it's delaying my ability to treat you, which then delays your recovery from the condition that brought you to see me in the first place.
There's always some delay with bureaucracies.
Why the delay? The bill's author, State Senator Delbert Scott, says turf battles between groups representing and overseeing doctors and nurses played a big part in it.
It can go as slow as somebody wants it to go. I don't know that anybody's on purpose killing the program, but I know that 2 years is enough.
We're as eager as anyone else to get this going.
Kit Wager, a spokesman for the Missouri Department of Health and Senior Services, says under new laws, the state needs a database to track not only nurse practitioners, but also physician assistants and the doctors they work with. That, he says, could cost the state nearly $800,000.
We have no money to build this database.
Some lawmakers are trying to find that money, but it still hasn't been approved.
Good job.
For Jane Hicks and her patients, the new law, even though it's delayed, promises to make getting the right health care a little easier, especially for people who use nurse practitioners and physician assistants, two professions expected to play a much bigger role in health care. It's unclear when it will finally be put into practice, perhaps not until next year. Craig Cheatham, News 4.